Hi there, I'm Susan.
And I'm John. We're here on behalf of Farm Bureau Health Plans to help you make sense of what can sometimes be a pretty confusing subject, Medicare. It's something we all need to think about sooner or later. And at Farm Bureau Health Plans, it's our job to help folks make important, well-informed decisions that make sense for individuals and their loved ones.
Whether you're approaching your 60s and starting to consider your options, or have existing Medicare coverage and might be considering other options, we hope our little chat will help. Let's face it, it's not the most exciting subject in the world, but it's important, and it can significantly impact your quality of life. Knowing Medicare basics can help you understand your options, which helps you make better choices based on your particular needs and circumstances.
I'm glad you mentioned choices. Okay, having choices is actually one of my favorite things about Medicare. Okay? The fact that it's not a one-size-fits-all program. There are many choices, and it's up to me to decide which options are best for me. The more you know about the choices you need to make, the more empowered you'll feel when the time comes to sign up for coverage or make a change.
I couldn't agree more. Let's get into it. In short, what is Medicare? It's a federal health insurance program that Congress created in 1965 as part of Social Security. It guarantees access to health care for everyone 65 and older.
So what about the people with disabilities or people here from other countries?
I'm glad you asked, John. To qualify for Medicare, you must be a U.S. citizen or permanent legal resident for at least 5 years. You must have paid Medicare taxes for at least 10 years. Permanently disabled people can claim Medicare benefits before the age of 65, and people of any age with certain diseases also qualify.
Good to know. But what's with all those Medicare letters?
Good question. It's important to understand the 4 different parts of Medicare. Part A is hospital insurance. Part B concerns medical insurance. Part C relates to Medicare Advantage plans, and Part D covers prescription drugs.
Okay, for Parts A, hospital, B, medical, C, Advantage, D, drugs. It's as easy as A, B, C, D. Got it. Now that it all seems pretty straightforward, but how do I sign up? Is it automatic? What do I have to do?
Medicare enrollment is easy, but it's not automatic. Enrolling means thinking carefully about timing and options. Aside from starting to enjoy your best years, you might want to keep 4 birthdays in mind.
4 birthdays? Isn't it enough just to keep up with one?
Okay, think of it as 4 years. The years you turn 62, 65, 67, and 70. These are important dates to keep in mind because when you're planning for Medicare, timing matters.
Tell me more.
All right. At 62, you become eligible for early retirement and related income benefits from the Social Security Administration. But claiming your benefits this early has repercussions. If you accept these retirement income benefits at age 62, the payments will permanently reduce by 30%.
Ouch, that's not good.
But it still could be. It depends on your situation. Some people will want to wait until they're older, up to 70, to claim more money. But others choose to take advantage of those benefits as soon as they're eligible. To go over all your options, visit ssa.gov.
So that makes sense. So the next stage to keep in mind is 65, right? The year I'll finally be able to buy discounted movie tickets.
I think so. But it's also when you and most people become eligible for Medicare benefits. People approved for Social Security disability qualify even earlier.
Well, hopefully I won't need it.
Well, sure. I hope you'll still be in peak physical condition too. But it's good to know that when you turn 65, you're eligible for Medicare benefits, even if you choose to delay enrollment.
Delay Medicare enrollment. Now, why would I do that?
Under certain conditions, people do. Maybe they're still working and have a great employer-based plan. We'll touch on that later.
Well, I say so. One birthday left to remember, 67, right? Okay, what happens then?
Well, when you turn 67, depending on your date of birth, you may be eligible for full retirement income benefits from the Social Security Administration.
Wait, are those Medicare benefits? No. They're monetary payouts from Social Security. Two different agencies, two sets of benefits. Social Security pays retirement and disability. Medicare pays medical. But all this is eligible stuff happens around the same time, so it just makes good sense to familiarize yourself with both.
Okay, gotcha. What else do I need to know about enrolling in Medicare?
Well, here's one important way that the Social Security Administration and Medicare are linked. If you're under 65 and already receiving monthly retirement or disability payments through Social Security, you'll automatically be enrolled in Medicare about 3 months before you turn 65.
Wait, but I thought you said I needed to do something to enroll.
You still might. If you're not receiving any payments from Social Security, meaning no retirement benefits yet, no disability payments, and you turn 65, it's up to you to enroll, so you can make sure that Medicare is ready to cover your medical needs.
All right, I follow you at the moment. It sounds good to me to delay my Social Security payments until I'm 70 so I can get the maximum payout.
I expect I'll still be healthy, and I don't expect disability payments, so I'll need to enroll myself in Medicare when I turn 65.
That sounds like a plan. It actually is pretty easy. Once you're eligible, you can enroll in Medicare via the Social Security Administration online, over the phone, or in person at your local field office.
What if I'm in a different situation and already have health insurance of some kind?
Well, I'm glad you asked that, John. At age 65, if you're ready to claim your Medicare coverage, you should go ahead and enroll. Even if you have a health insurance marketplace plan, a small employer group plan, or privately purchased plan. And you should definitely enroll if you have no health insurance at all.
No, absolutely. I mean, what else should I keep in mind when I turn 65 and become a Medicare enrolled senior citizen?
Well, other than the fringe benefits like discounts on just about everything, there is that punctuality thing.
What punctuality thing?
Oh, well, let's just say it's not the absolute strongest of your many attributes.
Okay, Susan. No, that's fair. Okay, guilty as charged. So why do you mention that?
Well, because when it comes to Medicare, John, late enrollment carries a consequence, which is a 10% increase of your Part B premium for every 12-month period you're late in enrolling. We'll talk more about Part B and the others shortly.
That's not the worst of it, though.
The increased premium lasts as long as you're on Medicare.
Oof.
Yeah, it adds up. So it's definitely worth your while to get the facts ahead of time, well before you turn 65, and get a plan together.
Okay, so now I'm convinced about planning ahead for this. Anything else I should keep in mind about setting up Medicare the right way at the right time?
For sure. I'll enroll in Medicare benefits at age 65. You'll need to sign up for Medicare Parts A and B, along with any insurance you'd like to go along with it for coverage during your IEP. Your IEP is your initial enrollment period of 7 months, starting 3 months before you turn 65 and including the 3 months after. It's the best time to enroll.
So if I add the month I actually turn 65, I have a total of 7 months.
Exactly. You won't want to be stuck without coverage during any of these months.
So that's the enrollment period. But when did the Medicare benefits actually begin?
The effective date is determined by when you enroll. So if you enroll during those first 3 months, your coverage begins on the first day of your birth month, the month you turn 65. If you wait until the 4th, 5th, 6th, or 7th month of that IEP, there will be a 1 to 3 month delay.
It sounds a little complicated, but my takeaway hasn't changed. Must plan ahead.
I think you're onto something there, John, but it gets a little more complicated than that.
But don't tell me there are other enrollment periods with other rules.
Yeah, but it's not so tricky to follow. Just remember that it all depends on your age, your particular circumstances, and which rules apply accordingly. Plus, you can always get help sorting this stuff out from the friendly folks at Farm Bureau Health Plans like us.
Good point, Susan. But what were you saying about the other Medicare enrollment periods? That there are just a few more?
3, to be exact.
No kidding.
Yep. In addition to the IEP we just covered, there's the Annual Open Enrollment Period, or AEP, between October 15th and December 7th every year during this window. You can shop for Medicare Advantage and Part D plans that will take effect the following year.
And we'll touch on the different parts like Part D in a minute. But in addition to IEP, you also have SEP, or Special Enrollment Periods. These are time-limited opportunities to enroll in Medicare outside your initial enrollment period, but only when certain conditions are met.
Really? What kinds of conditions?
You know, like if you move, lose your current coverage, have a chance to get other coverage, or your plan changes its contract with Medicare.
Is that all of them?
Nope. You can read all about the special circumstances for SEP at Medicare.gov. But there's just one more enrollment period you really should know about. It's the General Enrollment Period, or GEP. You can use it to enroll every year between January 1st and March 31st, but only if you didn't sign up when you were first eligible, and you aren't eligible for special enrollment periods. Either way, your coverage will begin on July 1st.
Once you've seen them all together like that, they're actually pretty straightforward, don't you think, John?
Well, I keep having to admit that. You're right, Susan. Thanks.
Anytime. One more thing about Part B. You can actually delay your enrollment and sign up later with no penalty. If you're already covered by a large employer, your group health plan based on your own or your spouse's current employment, as long as it's not COBRA or retiree coverage. It's good to know Part B is the medical insurance part of Medicare. We'll talk more about those parts in a minute. This delayed enrollment without penalty applies to employer plans with 20 or more employees.
Well, it's nice that they're making it flexible for people.
Indeed it is, John. Here's where that special enrollment period, or SEP I mentioned earlier, comes in. It will allow you to enroll in Part B later without penalty, giving you 8 months from the end of your employment or the end of your employer's coverage, whichever comes first, to use the SEP. If you don't use it, you'll need to wait until the next General Enrollment Period, or GEP, to enroll in Medicare.
Well, that sounds reasonable to me, Susan.
Well, at this point, I think it would also be helpful to our viewers if we reviewed a few of the more common terms related to insurance when we're talking about Medicare. They get used a lot, but unless you're using them regularly, you might not remember exactly what they mean.
Excellent suggestion, Susan. You mean insurance jargon like premium, deductible, copay, and co-insurance, I bet.
Precisely, John. Check out these 4 commonly used insurance terms that are good to remember. All right, let's start with Part A, hospital coverage, which covers some but not all costs of an inpatient hospital stay. Doctor services are covered under Medicare Part B, which we'll get into in a moment. Part A also covers skilled nursing care, which is different from custodial or long-term care for up to 100 days, and home health care. If you're unable to secure necessary inpatient services at the hospital, as well as hospice care as needed.
Wow. There's a lot of coverage in Medicare Part A, absolutely, and we all hope we won't need it anytime soon.
But again, it's nice to know it's there when we do. Part A benefits begin the day you're admitted as an inpatient and last without copays for 60 days. No premium is charged if you have paid FICA taxes for at least a decade, which is nice.
Definitely, but if you don't meet the qualification, you can still buy Part A coverage.
All you need to do is have Part B medical and pay monthly premiums for both A and B.
How would I go about setting that up?
The best way is to just get in touch with the Social Security Administration, and they'll fill you in on all the details. While we're at it, we should probably point out a few more numbers related to Part A, don't you think?
I'm right there with you, Susan. I was just about to mention deductibles per benefit period.
Speaking of Part A hospital costs, you're responsible for the deductible per benefit period. But depending on your circumstances, there could be multiple benefit periods within a year.
Well, that's interesting. What about copays for Medicare Part A?
There's no copays for the first 60 days of a Part A benefit period, but starting on day 61, copays jump significantly. If you're still in the hospital after 90 days, and we sure hope you're not, you'll have another jump in copay per day after day 60, what Medicare calls lifetime reserve days.
Okay, what about skilled care costs? Those can also add up to the hospital bill, right?
Oh, absolutely. Those are good to keep in mind as well. Skilled care costs have no deductible for the first 20 days in hospital. On the 21st day or the 100th day, however, you'll be responsible for coinsurance beginning with the 101st day in the hospital and onward. You're responsible for all the skilled care costs.
Well, that's good to know. Well, how about Part B then? Does it have a standard premium?
Well, I'm glad you asked that, John, because it's important to remember, and this one has a little more nuance. Yes, Medicare Part B medical has a standard premium, but Medicare charges you more if your tax return from 2 years ago says you made more than a certain amount. In that case, the IRS slaps an IRMA on you, right?
Yeah, IRMA. Yes, you could say that if you meet either of those criteria, the IRS places you on a higher income category and will apply the income-related monthly adjustment amount. That means you're still on the hook for a standard premium plus the IRMA.
Well, the good news is, because of Medicare's close ties to Social Security, Part B premiums are automatically deducted from your monthly Social Security check, right?
Right. Okay, but what if I have not started drawing Social Security yet?
Well, in that case, John, you'll get a bill called a Notice of Medicare Premium Payment Due. And then you'll have a few choices. You can pay it via a check, money order, debit card, a credit card, using your own bank's online bill payment service, or through Medicare Easy Pay.
Okay. Well, while we're still on Part B, what does it cover?
Part B is used more than any other Medicare benefit. It covers services you receive from doctors and other healthcare providers, including outpatient care, home health care, durable medical equipment like oxygen, wheelchairs, hospital beds, diagnostics, and lab tests like EKGs and MRIs. It also covers preventative services like mammograms and colonoscopies, and your initial Welcome to Medicare visit.
Wow, that's a lot of coverage. But what about Part B deductibles?
With Medicare Part B, it's pretty simple. Part B does have an annual deductible plus an expectation of coinsurance liability. Some preventative services are even free.
Well, that one is indeed simple. Good to know. With Part A and B, it looks like I'll be set up with lots of coverage already. Maybe we should touch on Medicare Part C.
Well, sure thing. Part C is Medicare Advantage plans. These are health insurance plans you can purchase from a private company that has entered into a contract with Medicare to co-manage your benefits, cover any gaps, including dental, vision, gym memberships, and other benefits. Standard Medicare Part B premiums, as we touched on before, are still applicable here in Part C. Plus, in order to qualify for an Advantage plan, you must live within its designated service area, use that plan's provider and pharmacy networks, and obtain physician referrals as the plan requires for various services.
And one more thing. Advantage plans don't always cover drugs. Those are covered by Part D, which we'll get into shortly. Advantage plans bundle hospital, doctors, and sometimes prescription benefits. But doctors and hospitals are not required to accept Advantage plans, and some may not include your doctor. So again, it's good to do your homework and check with your providers about whether they accept Advantage plans.
Excellent advice, John.
Thanks, Susan. I knew you'd come around. What if I need to make a change to or from an Advantage plan?
Mid-year network changes between providers and plans are allowed, but it's always good to check and make sure that all your medical providers accept the Medicare Advantage plan you're considering before you make the purchase.
Okay, and that's because of the network requirement.
You've got it. Medicare Advantage Part C plans are based on network provider, of which there are two main networks. One, health maintenance organizations, HMO, require you to remain in network for services and obtain referrals from primary care physicians to see specialist preferred provider organizations. 2, PPO gives you the option to remain in-network or pay a fee to see out-of-network providers who agree to accept your insurance plan. Unlike HMOs, PPOs don't require referrals.
Okay, I like the sound of those options. But what about enrollment periods for Part C?
Using a Medicare Advantage plan under Part C means you must live in the plan service area and you may only apply to enroll during an authorized enrollment period.
Oh, wait, you mean like the initial enrollment period, IEP, open enrollment period, OEP, and special enrollment period, SEP?
Yes, I do, John. Plan benefits, cost sharing, and provider networks may all change annually, and some of these changes are even up to you to make, as long as you make sure to adhere to the appropriate enrollment periods to make them.
Well, that makes sense. Now, anything else we should keep in mind about Medicare Advantage plans under Part C before we move on to Part D?
Yes, Medicare Advantage plans usually require copays when service occurs. Premiums can vary, as well as out-of-pocket costs may vary monthly according to services received. So, budgeting can get tricky. And remember that a $0 premium plan is not necessarily a zero-cost plan. So read the fine print, plan ahead, and ask questions, and make an informed decision.
Well, I can't help think that you've done this before. One thing you forgot to mention is that with Medicare Advantage plans, getting coverage while traveling can be challenging, as Advantage plans are only required to cover emergency out-of-network care. And sometimes plans may dispute a doctor's plan of care, which can lead to refused coverage for services your doctor recommends.
So this brings us to Medicare Part D. This one's pretty easy to remember. D is for drugs, correct?
Essentially, Part D is prescription insurance purchased from a private company approved by Medicare. It is available as either a separate standalone plan if your additional health insurance is a Medicare supplement, or as a feature included with some Medicare Advantage plans. How do I know which of these is best for me?
The best prescription drug plan for you is highly individualized. It should be based on the medications you take. Therefore, it won't be the same for everyone, not even your spouse. Part D decisions are pretty personal. Enrolling in Part D is optional, but late enrollment penalties do apply, so plan ahead.
You've got it, partner.
How to put it all together in a way that works best for you. Now that's what I'm talking about. So luckily, all of this still comes down to options. Your first option could be electing to go with just Medicare Part A and Medicare Part B. These two parts together are sometimes known as Original Medicare. This is what most people think of when they think of Medicare. You're covering potential hospital stays and related medical care.
Well, that's tempting, Susan, especially for healthy folks, but the odds don't look so good even for them as they get older. People need to remember that if they only have A and B, only part of their health care bills will be covered. There will still be deductibles, copays, and coinsurance. Part B can involve excess charges. If a provider doesn't accept assignment, there's not a maximum out-of-pocket limit either, so you're at real risk if and when catastrophe strikes.
Well, that sounds scary, but you're absolutely right, John. When it comes to complex decisions like this, it's especially tempting to just pick something that sounds simple and get it over with.
That is so true, but I think we both agree that when it comes to Medicare, we've got to do our homework for the sake of our health and the loved ones who look out for us.
Indeed. It's also pretty important to remember that Parts A and B alone will not cover any long-term care prescription drugs, routine dental care, vision care, or hearing aids.
Some people also add an additional plan or two for dental and/or vision. Medicare supplement plans, or sometimes called Medigap plans, help cover gaps in Medicare coverage like deductibles, coinsurance, and certain limitations that can really add up, particularly if you're in an accident or facing a long hospital stay.
Farm Bureau Health Plans offers 4 of these Medicare supplement plans, also known as standardized Medigap plans, A, D, G, and N. They're affordable, easily understood, and can deliver big savings, covering gaps at affordable rates. Farm Bureau Health Plans provide superior customer service to deliver real peace of mind.
Indeed, supplemental plans let you visit any doctor or hospital that accepts Medicare. so you can keep your doctor or pick a new one that you later prefer. You're also more easily able to budget your own healthcare costs because you know what your monthly premiums and deductible amounts will be ahead of time. And most plans don't require copays. You're also covered anywhere in the USA, anywhere providers accept Medicare, and even sometimes foreign travel.
That's amazing. But don't forget, you'll still be on the hook for prescription drugs, dental, vision, and hearing-related services. Medicare supplements won't cover those.
That's okay though. I plan to pick up Part D coverage just in case I need those drugs. I think when the time comes, a dental vision plan from Farm Bureau Health Plans may be just what I need for those other services. We'll talk more about that in another chat.
Sounds good, John. While we're still on the topic of Medicare supplements, we should point out that they don't scrutinize services received and approved by the original Medicare. Original Medicare pays first and then sends any applicable remaining balances to the Medicare Supplement Plan or Medigap plan, which pays the claim. Super handy.
Standardized by the federal government, each of the 4 supplemental plans that Farm Bureau Health Plans offers include a unique set of benefits. So, when's the best time to enroll?
The best time to enroll in a Medicare supplemental plan from Farm Bureau Health Plans is within the first 6 months after your Medicare Part B effective date, after which time medical underwriting will apply.
Remind us all of what medical underwriting is.
Well, it's when an insurer reviews your medical history to decide whether you're eligible for one of their policies, and whether that policy will have pre-existing condition, exclusions, or higher premiums as a result.
Right. This is a big deal. Not all companies that offer Medicare supplement plans give folks a chance to enroll without underwriting. Farm Bureau Health Plans allow people a chance to enroll without underwriting into a currently available Medicare supplement plan within 63 days of leaving any employer or group health plan for any reason, whether you're leaving coverage obtained through a job, COBRA, a spouse's coverage, or retiree coverage.
Another excellent benefit indeed.
One key point is that while pricing methods for supplements can vary among states, they're usually rated according to one of 3 factors. First, the attained age, meaning the premium increases annually. Second, the issue age, meaning premiums can depend on your age when the policy was purchased. And third, community rated, meaning that everyone pays the same premium regardless of age.
Good point, John.
Thanks. But wow, Medicare supplement plans from Farm Bureau Health Plans sounds like a great option for a lot of people.
I know that Farm Bureau Health Plans offers great Medicare supplemental plans, but how do I decide whether a Medicare supplement or a Medicare Advantage plan is best for me?
Again, it's all about your personal needs and circumstances. Start by asking yourself some questions. Which type of insurance will best suit your needs? How important is it to you to stick with the same doctor? Are you willing to have copays every time you receive services? Is it important to you to know exactly how much you're spending on healthcare every month? Do you need health coverage while traveling? How much leeway are you comfortable giving the insurance company to decide where you receive care and for how long?
Which type of scenario fits your budget? Think about your needs, review the plans available to you, and make the call.
It's still a lot to consider. I need to estimate my annual costs for out-of-pocket expenses, including my premiums, deductibles, copays, and/or co-insurance. I need to compare estimated annual costs between plans, because comparing single costs doesn't really illuminate that big picture. Sometimes low premium plans have high deductibles or copays.
You're exactly right, John. But it's still possible that you'll not need a Medicare supplement, Medicare Advantage, or even a Part D drug plan. What if the time comes and you already have coverage through other means to fill in the gaps where Medicare doesn't pay?
I mean, who knows what I'll be up to when I'm 65? But by then, I might have a group health plan based on whatever job I have at the time, or retiree coverage for Parts A and B if I'm not working. Maybe I'll get a job with the federal government and have the Federal Employee Health Benefits Plan, TRICARE for life, or even coverage from the VA if I were a veteran.
I know these situations might not apply to you, but they might matter to our viewers, because when it comes to retirement, some folks are going to be all set with the coverage they already have. This brings us full circle back to Farm Bureau health plans.
You mean, when I'm trying to sort out what my Medicare needs will be, should I consider Farm Bureau health plans?
Bingo. First, you'll probably want to go with a company that has significant experience and a great track record. Farm Bureau Health Plans has been selling Medicare supplement plans since 1966.
What about when I have a question about a claim?
Well, I call. All claims are processed and serviced in Columbia, Tennessee. I know that we said sometimes these Medicare supplement plans are also called Medigap plans because they fill in the gaps around traditional Medicare coverage.
Right. Farm Bureau Health Plans offers 4 of the 8 standardized Medigap plans, including A, D, G, and N.
Farm Bureau Health Plans also offers dental and vision plans for folks on Medicare using Delta Dental and VSP networks. Waiting periods on dental are waived if you enroll during your IEP or Medicare open enrollment. If you purchase a health, auto, or home insurance policy, you must be a member of the Farm Bureau, which includes an annual membership fee.
But joining unlocks multiple benefits and discounts too. I don't remember talking about the specifics of Medicare supplement plans like G or N. How can I learn more about those, and where do I go if I'm ready to enroll?
With Farm Bureau Health Plans, it's easy to find a friendly expert at Farm Bureau Health Plans who can tell you all about your options. Go to fbhp.com.
Are there any other good resources out there for when I'm doing my Medicare homework?
Oh, definitely. Another great resource is the Social Security Administration, in which you can reach at ssa.gov. They can help with A and B enrollment issues, financial assistance, and address changes.
Excellent. I feel much better already. Now that we've gone over most of this and equipped ourselves with some of the best sources out there to learn more, making an informed decision takes a little work, but it's worth it.
I'm so glad it was helpful, John. Thanks for helping me explain these concepts to our viewers. I hope many of them end up finding it useful too.
Well, I'm sure they will, Susan. Thanks again for helping me get the word out.
Oh, it's my pleasure, John. See you next time.
Bye now.